Okay, let's dive into this. Welcome to today's Explainer, where we're going to unpack a deeply empathetic, highly practical toolkit for caregivers. Just a quick note, we are exploring this topic today purely for educational purposes. Because look, if you're caring for someone with Alzheimer's or dementia, you already know the daily routine can sometimes feel like, well, an endless uphill climb. And honestly, there is probably no better example of that than the daily battle of medication time. Right? It can be brutal. So our goal today is to discover some really concrete, actionable strategies together. We want to help you navigate this specific hurdle and hopefully transform a moment of intense daily stress into an opportunity for structured, compassionate care.
Listen to this quote from our source material. "Grandma hates taking her medicine even after I tell her what it's for." Wow, if you're a caregiver, I bet that captures your exhausting reality perfectly. I want to validate your frustration right out of the gate here. You're trying so hard to do the right thing. You're trying to keep your loved one healthy, and yet you're met with this brick wall of resistance day after day. It's incredibly draining. You put all this love and effort into someone's well-being, only to have them literally fight you on the very things keeping them stable. But as you'll see, you are absolutely not alone in this.
10? That might literally be the number of times in a single morning your loved one asks why they have to take their pills. You explain it clearly, gently, and then 5 minutes later, boom, the cycle repeats. This repetitive loop, it is unbelievably taxing. It drains your energy and, let's be real, your patience. But what we really need to understand here is that this repetition isn't them trying to test your limits. Not at all. It's a direct result of their cognitive decline. The memory of your perfectly logical explanations simply vanishes, which leaves them feeling confused and defensive all over again.
And, that confusion leads straight into a very recognizable dialogue. It usually goes something like this. I don't need to take medicine. Who said I have to take that medicine? For what? Now, as a caregiver, your first instinct is almost always to use logic, right? You tell them, well, you have high blood pressure, you have diabetes. If you don't take this, you're going to get sick. But we have to realize that relying on logic often just tracks us in this frustrating, unwinnable argument. The patient simply doesn't believe they are sick. To them, they feel totally fine in that exact moment. So your logical explanations about future health consequences, they completely miss the mark.
So the crucial point is this. Refusal to take medication is a common manifestation of dementia. It's not intentional stubbornness. Actually, let's reframe that. It is literally a symptom of the disease itself. When we shift our perspective to recognize this medical reality, it kind of changes our whole approach. You aren't fighting a stubborn relative anymore. You're managing a symptom of a neurological condition. Keeping this clinical reality top of mind is your secret weapon for staying calm. It allows you to depersonalize the rejection and just focus strictly on your caregiving strategy.
Which brings us to a really fascinating psychological dynamic. Your frustration actually mirrors onto the patient. Think about it. When you're worn down, when you let out a heavy sigh, or when your voice gets just a little bit tight, they notice. Even with memory loss, folks with dementia often retain this incredibly sensitive emotional radar. If you let your annoyance bubble up, they're going to pick up on those negative vibes immediately. And what happens? They get anxious, defensive, and annoyed right back at you. So your frustration actually becomes part of the problem, escalating the exact behavior you're trying to calm down.
Okay, enough about the problem. Let's talk behavioral solutions. Now that we understand the psychological landscape, we can apply some really clever tools. Our source material highlights an absolutely brilliant first strategy. We call it the doctor's note. This is a highly effective tactic where you essentially lean on an authority figure that the patient still respects and really wants to please. For a lot of older generations, the word of a doctor is absolute law. By shifting the demand from you, the family member, to the doctor, you instantly remove all that emotional baggage of your personal relationship from the medication routine.
Let's look at exactly how this plays out, with a specific and, frankly, genius example from our source material. The caregiver actually creates a physical artifact. She says, remember, Dr. Brown said you have to take medicine for your blood pressure. He even wrote a note, my patient Aura Jackson needs to take her blood pressure and diabetes medicine every day. See what she did there? Having a physical piece of paper, using the doctor's name, and specifically using the patient's full name creates this undeniable sense of authority. It bridges that cognitive gap because they can physically see the proof right in front of them.
And what's so fascinating about this interaction is the immediate success of that deflection. The patient actually responds with, okay, I'll take it today only because Dr. Brown said it's a good idea. Do you see what just happened? The caregiver is no longer the bad guy forcing the issue. The pressure has been entirely offloaded to Dr. Brown. Your loved one takes the medication not because they lost an argument with you, but because they're complying with a respected medical professional. It completely preserves their dignity, and hey, it accomplishes your health goal at the exact same time. A total win-win.
But wait, once that goal is achieved, you can't just stop there. You must immediately pivot. This next essential tactic is called redirection. The very second those pills are swallowed, you want to shift their attention to something positive. Something like, oh, I have an idea. Let's take the dogs outside for a walk. It's a beautiful day. This interrupts any of those lingering negative feelings about the medication. By immediately introducing a fun, engaging activity, you effectively reset their emotional state. It stops them from dwelling on the fact that they just did something they didn't really want to do.
And this brilliantly illustrates how much physical posturing matters in caregiving. Seriously, picture it, standing over someone while holding a tiny cup of pills. It can feel incredibly intimidating, especially to someone who is already confused or feeling vulnerable. It triggers a totally natural defensive response. But if you simply pull up a chair and sit next to your loved one, it transforms the entire interaction. It goes from this weird dynamic of dominance to one of partnership. You're alongside them, helping them rather than commanding them from above. It is wild how this simple shift in physical space can instantly dissolve tension.
Of course, sometimes the refusal isn't behavioral at all, it's purely physical. If the actual physical act of swallowing pills is the root of the issue, we have some very actionable logistical steps. Step 1. Always check with your pharmacy to see if the medications are available in liquid form. If they aren't, move to Step 2. Consider crushing the pills and mixing them into something tasty, like applesauce or pudding. Just a quick aside here, always verify with a pharmacist that the specific pill can safely be crushed first. And finally, Step 3. If they absolutely must take whole pills, give them just one at a time with a sip of water. Please don't overwhelm them with a giant handful of medication all at once.
But what happens when you've done everything right? You've stayed calm, you've used the doctor's note, you're sitting right next to them, the pills are hidden in applesauce, and they still firmly, flat out refuse. Well, this brings us to a natural follow-up question that literally every caregiver faces at some point. What if the refusal continues? It's completely normal to feel a massive spike of panic right here. You start worrying that their health is in immediate jeopardy if they miss a dose by even an hour. But our source material offers a very clear, highly pragmatic approach to this exact stressful scenario.
The absolute best thing you can do? Just allow them to calm down for a few minutes. Literally walk away. Try again later. Be patient and keep in mind that this process might take several attempts throughout the morning. And you know what? That is perfectly fine. Let the tension dissipate. Forcing the issue is only going to result in a traumatic experience for both of you. By stepping away, you hit the reset button on the environment. Often, when you return 15 minutes later, their mood has completely shifted, the previous argument is forgotten, and they'll take the medication without a second thought.
Finally, I want to leave you with this incredibly empowering question. If today is just a truly, undeniably bad day, what is the single most important medication right now? Because sometimes, despite all your wonderful patience and clever tricks, it's just not going to happen perfectly. And on those days, you have to prioritize. Consult with their doctor beforehand so you know exactly which medication is absolutely critical, and focus only on that one. Let the vitamins or the extra supplements go for the day. Triage the situation. It reduces your overwhelm and ensures your loved one still gets their vital care. Thank you so much for joining us for this explainer. But before you go, it really makes you wonder, if a simple change in posture or a quick note from a doctor can completely transform medication time, what other exhausting daily caregiving battles could be solved by just slightly shifting our perspective?